Warning: never eat almonds if you have these 5 silent health issues after 60, and here's exactly why you need to pay attention. Almonds have a reputation: nutrient-dense, heart-healthy, a go-to snack for people who want to age well. But for many older adults, that same handful can quietly make an existing problem worse. Today, we'll walk through 5 often silent conditions that make almonds a risky choice after 60, the specific almond compounds involved, the subtle signs to watch for at your kitchen table, and what to do next. If you snack on almonds regularly, this video is for you, and if you're caring for someone older, please watch with them. Before we dive in, do you eat almonds every day or keep them in a jar on the counter? Tell us in the comments. Your experience helps others know what to look for. We don't want to frighten anyone. Research and guidance from allergy specialists, kidney experts, gastroenterologists, and dietitians show that almonds contain several natural compounds: oxalates, phytates, lectins, tannins, amandin, and a fatty acid profile higher in omega-6 that interact differently depending on a person's health. For most people, these interactions are harmless or even beneficial. But if you're carrying one of these 5 silent health issues, almonds may do more harm than good. We'll cover allergies first, then kidney stones, digestive disorders, thyroid dysfunction, and autoimmune conditions, and then balance the picture with the nutrients almonds can provide if you tolerate them. 1. Nut allergies, the acute risk that can appear late in life. Allergy is the one danger most people already know. Yet nut allergies are not only a childhood problem. Adults, including seniors, can develop an allergy to almonds at any age. The main almond protein implicated is commonly called amandin. It can trigger the immune system in sensitive people and produce a range of reactions from mild to life-threatening. How the reaction works in plain language: your immune system mistakes a protein in the almond for something dangerous and mounts an attack. That attack causes histamine and other chemicals to flood your body, producing symptoms that can show up in minutes or sometimes more slowly. What to notice: a tingling or itchy mouth right after eating almonds, hives or itchy skin, swelling of the lips or face, nasal congestion or sneezing, coughing, wheeze or shortness of breath, or stomach cramps and vomiting. In severe cases, there's a rapid drop in blood pressure, trouble breathing, or loss of consciousness. That's anaphylaxis and is a medical emergency. Practical steps at home: if you have any history of reactions to tree nuts, or if you experience the oral itching or hives described above after almonds, stop eating them immediately and consult an allergist. Allergy testing, skin prick, or a blood test can clarify whether almonds are a trigger. If testing confirms a life-threatening allergy, your clinician will advise you on avoidance strategies and emergency plans. A short vignette. Mary, 68, had never had food allergies as a child. Lately, she noticed her mouth went numb and itchy after finishing a handful of almonds while watching TV. At first, she dismissed it, but the next time, her lips started to swell. She stopped eating almonds and saw an allergist. Tests showed almond sensitivity. For Mary, avoidance and a clear emergency plan were the right steps. Allergies are often obvious because symptoms come on fast. The next 4 issues are quieter. They can worsen over time and are easy to miss. 2. Kidney stones, the oxalate connection many seniors don't realize. Kidney stones are very common after age 60 for some people, and almonds are relatively high in oxalates, plant compounds that can combine with calcium to form the most common type of kidney stone. For people with a history of oxalate stones, or those who have lower kidney function, consuming large amounts of oxalate-rich foods can increase stone risk. How the mechanism works: simply, oxalate in the gut can bind with calcium and, if not flushed out, crystallize in the urinary tract. Hydration, urine volume, and the balance of dietary calcium and oxalate influence whether crystals form. Almonds contribute oxalate, and in some contexts they can push the biochemical balance towards stone formation. What to notice: a history of kidney stones, sudden severe pain in the back or side, blood in the urine, recurring infections, or persistent kidney discomfort. But stones can also form quietly at first, so your history matters. If you've had stones before, that's a clear signal to reassess almond intake. Practical steps at home: if you've had kidney stones, especially calcium oxalate stones, talk with your nephrologist or urologist before keeping almonds as a daily habit. They may recommend dietary adjustments, improved hydration, or tests to determine your stone risk. In the meantime, avoid consuming large quantities of almonds every day and increase fluid intake. It's not necessary to ban all nuts without guidance. Your clinician can help you choose lower oxalate options if needed. A short vignette. Antelia, 71, left snacking on almond-based bars every afternoon. After a painful stone episode 3 years ago, he thought his diet wasn't a factor. When he reviewed his foods with a kidney specialist, he learned that his frequent almond sensitivity was contributing to higher oxalate levels. He cut back, worked with his clinician on hydration habits, and reduced his recurrence risk. Transition.
Many digestive and mineral absorption issues overlap with oxalate and phytate chemistry, which brings us to the gut.
Digestive disorders, IBS, Crohn's, leaky gut, and how almond compounds can irritate the gut. Digestive conditions like irritable bowel syndrome, IBS, inflammatory bowel disease, IBD, which includes Crohn's, and increased intestinal permeability, often called leaky gut, are more common or more symptomatic as people age. Almonds contain phytic acid, tannins, and lectins, natural plant compounds that can be hard on sensitive digestive systems in some people. How the mechanism works in plain language: phytic acid binds minerals, which can interfere with absorption in people who already have compromised digestion. Tannins and lectins can irritate the lining of a sensitive gut, triggering inflammation or cramping. For someone with inflamed or damaged intestinal tissue, these compounds may worsen symptoms like pain, bloating, diarrhea, or constipation. What to notice: increased bloating after eating nuts, abdominal cramping, a change in bowel habits, more frequent diarrhea or worsening constipation, or a sense of food intolerance that appears after a meal with almonds. People with diagnosed Crohn's or active flare-ups should be particularly cautious. Practical steps at home: if your gut feels worse after not heavy meals, pause almond consumption and keep a simple food and symptom diary for a couple of weeks. Talk with your gastroenterologist or a registered dietitian who specializes in GI issues to test for intolerances, review your diagnosis, and design a safer snack plan. Blanched or soaked almonds may be easier for some people, but that's an individual response. Discuss it with your clinician before experimenting. A short vignette: Rita, 65, has long-standing IBS. She noticed that on evenings she snacked on almonds, she was more bloated and uncomfortable. After she stopped almonds for a month, her symptoms eased. With her dietitian's help, she switched to lower tannin seeds and found a better balance. The gut and minerals set the stage for another hidden risk: the thyroid. Thyroid dysfunction, mineral binding and fatty acid balance that can complicate thyroid health. Thyroid issues like hypothyroidism, including Hashimoto's autoimmune thyroiditis, are common in older adults. Almonds don't directly cause thyroid disease, but in certain situations, components in almonds can interfere with mineral availability and with the body's inflammatory balance, potentially complicating thyroid function and medication management for people who already have thyroid problems. How the mechanism works explained simply: almonds contain phytates that combine minerals such as iron, zinc, and to a lesser degree, iodine-related compounds that your thyroid needs to make hormones. Additionally, almonds have a fatty acid profile that is higher in omega-6 polyunsaturated fatty acids, PUFAs, than omega-3s. In people with existing thyroid issues, an unbalanced omega-6 to omega-3 ratio may contribute to inflammation or affect cellular signaling. Finally, some compounds in plant foods can interfere with the absorption of thyroid medications if consumed too close to the time you take your pill. What to notice: more fatigue despite taking your usual medication, increased sensitivity to cold, unexplained weight changes, hair thinning, slower heart rate, or feeling off in ways you don't normally. If your thyroid levels have become harder to stabilize, look back at diet patterns. Frequent almond intake could be a contributing piece, especially if paired with other high phytate foods and low dietary mineral intake. Practical steps at home: don't stop medication or make medication changes on your own. If you have diagnosed thyroid disease and you snack on almonds every day, bring this up with your endocrinologist or prescribing clinician. Ask about timing of your medication relative to meals, and discuss whether your diet could affect mineral status. Your provider may check iron, zinc, and thyroid hormone levels and suggest diet adjustments or supplements if necessary. For some people, reducing almond frequency and adding omega-3 rich foods can be helpful, but medical guidance is essential. A short vignette: John, 62, has Hashimoto's and noticed he felt unusually tired despite taking his medicines. After his doctor checked labs and reviewed his diet, they discovered he was eating large portions of almonds with every meal. A trial of reducing almond intake along with nutritional follow-up helped him achieve more stable thyroid levels. Transition: when the immune system is already on edge, certain food components can tilt the balance toward flare-ups. That's our final warning. 5. Autoimmune disorders, lectins, omega-6 balance, and inflammation. Autoimmune conditions such as rheumatoid arthritis, lupus, multiple sclerosis, and autoimmune thyroid disease become more common or more active as people age. For someone with an autoimmune condition, certain food components that modulate the immune system can exacerbate inflammation. Almonds contain lectins and are relatively rich in omega-6 fatty acids. In susceptible individuals, these factors may contribute to a pro-inflammatory environment. How the mechanism works in accessible terms: lectins can interact with the lining of your gut and in some cases influence immune signaling. Omega-6 fatty acids are not bad on their own, they are essential, but when consumed in excess without enough omega-3s, the balance can shift toward inflammation. For an immune system already primed to attack the body's own tissues, that extra inflammatory nudge can worsen symptoms or increase the frequency of flares. What to notice: worsening joint pain or stiffness, new or increased skin rashes, fatigue that coincides with eating certain foods, increased morning stiffness, or other flare-like symptoms that seem to track with diet.
If you notice that autoimmune symptoms spike after a meal containing almonds or almond products, that's a red flag worth investigating. Practical steps at home: if you have an autoimmune diagnosis and you suspect almonds are linked to flares, avoid them for a trial period and speak with your rheumatologist or immunologist. Ask whether diet might be playing a role in your symptoms and whether an anti-inflammatory nutrition plan or testing could help. Registered dietitians who specialize in autoimmune and anti-inflammatory diets can offer individualized alternatives and help ensure you still receive the nutrients your body needs. A short vignette. Evelyn, 70, has rheumatoid arthritis and found that weeks when she ate a lot of almond-based snacks, her joints felt stiffer and more painful. After she cut almonds from her routine and worked with her rheumatologist on a diet plan, she noticed fewer flare-ups and improved pain control. Balancing the picture. Why almonds are still a nutrient-rich food for many people. It wouldn't be fair or useful to end on a list of risks alone. For many older adults who tolerate them, almonds provide real benefits, but the key word is tolerate. Here are 5 ways almonds can help when there is no contraindicating condition. First, vitamin E. Almonds are a rich source of vitamin E, a fat-soluble antioxidant that supports brain and cognitive health. Observational research links adequate vitamin E intake with certain measures of cognitive resilience. While no food guarantees memory protection, vitamin E is one nutrient that contributes to healthy aging. Second, skin and tissue repair. Almonds contain zinc and antioxidants that help with skin integrity and repair. For older adults concerned about skin health, getting a variety of foods that supply zinc and antioxidants is part of overall skincare. Third, sleep and relaxation. Almonds provide magnesium and a small amount of tryptophan, nutrients that support relaxation and may help with sleep quality for some people. If poor sleep is your main issue and you tolerate almonds, a modest serving in the evening could be part of a broader sleep support strategy. Fourth, red blood cell support. Almonds have riboflavin and some iron, nutrients that support energy metabolism and red blood cell function. In combination with other iron and B vitamin sources, almonds can contribute to overall metabolic health. Fifth, muscle recovery and vascular support. Almonds provide magnesium and the amino acid arginine, which play roles in muscle function and blood vessel health, useful for active seniors who want to recover well after activity. A cautious caveat, these benefits are conditional. If you have any of the 5 silent issues we covered, allergy, kidney stone history, sensitive gut, thyroid dysfunction, or autoimmune disease, the risks may outweigh these potential benefits.
For everyone else, moderation remains prudent. A typical recommendation many clinicians mention is about an ounce a day of nuts as a portion size, but your ideal intake should be personalized. Practical alternatives if you need to avoid almonds. If almonds are off the table for you, there are safe and nutritious alternatives, but tolerance varies. Walnuts are richer in omega-3s and may be preferable for inflammatory balance. Macadamia nuts are lower in oxalates and generally easier on the gut for some people. Pumpkin seeds and sunflower seeds provide magnesium, iron, and zinc without the same almond-specific proteins. Peanuts are technically legumes and introduce a different allergy profile. Don't substitute them without checking for peanut sensitivity. The safest approach is to work with a dietitian to identify alternatives that match your nutrient needs and your medical profile. A practical at-home experiment. Try a 2-week elimination where you remove almonds entirely and track symptoms in a daily note: what you ate, how you felt, energy level, digestion, sleep, and any allergic type responses. Share this log with your clinician. It can be an invaluable clue. A short checklist to bring to your clinician. If any of this resonates, here are the key points to take to your doctor. Ask about allergy testing if you've had oral itching, hives, or swelling. Review your kidney stone history and whether dietary oxalate reduction or hydration strategies are appropriate. Evaluate gastrointestinal symptoms with a gastroenterologist and consider a trial of elimination. Check thyroid labs and discuss whether dietary changes are impacting medication stability. And if you have autoimmune disease, ask your specialist whether a dietary trial or nutrition referral could help manage flare patterns. Put simply, get tested, bring your symptom log, and consult specialists: allergist for suspected allergies, nephrologist or urologist for stones, gastroenterologist for gut problems, endocrinologist for thyroid issues, and rheumatologist or immunologist for autoimmune conditions. A registered dietitian can help rework your meals so you lose no essential nutrients when almonds are removed. How to approach almond consumption if you don't have these issues. If you don't have any of the 5 conditions and you tolerate almonds, enjoy them in moderation. Think of almonds as one of many healthy foods, beneficial when part of a varied diet. Rotate your nuts and seeds to diversify nutrient intake and to reduce the chance of developing tolerances or sensitivities to a single food. Maintain good hydration, keep portion sizes reasonable, and pay attention to how you feel after eating any snack. A reminder about medication timing. If you take thyroid medication or other drugs influenced by food absorption, don't guess about timing changes on your own. Mention your almond or high phytate food habits to your prescriber so they can advise on timing and monitoring. Wrapping up the core message. We opened with a strong line for a reason. Almonds are widely praised, but they are not universally safe after 60. If you have any of these 5 silent conditions, nut allergy, history of kidney stones, sensitive or inflammatory gut disease, thyroid dysfunction, or an autoimmune disorder,
You should avoid almonds or at least pause their regular use until you've consulted with your healthcare team. For everyone else, almonds can be a nutritious part of a balanced diet, enjoyed in moderation. Final practical summary you can take away right now. Stop eating almonds immediately if you suspect an allergy. If you have a history of kidney stones, talk to your nephrologist about oxalate risk. If you have IBS, Crohn's, or ongoing gut symptoms, trial an almond-free period with your gastroenterologist or dietitian. If you have thyroid disease, consult your endocrinologist about diet interactions and medication timing. If you have an autoimmune diagnosis and symptoms flare with certain foods, discuss eliminating almonds and working with a nutrition professional. If this message landed with you, please do one simple thing. Share it with a friend, family member, or neighbor over 60 who snacks on almonds. You might save them from months of unexplained problems. And if you'd like to help the community here, comment below about how often you eat almonds and whether you've ever had a reaction. That kind of real-world information helps others notice patterns earlier. We've tried to be clear without being alarmist. Cause and effect in nutrition are complex, and individual responses vary. We're not saying almonds are evil, only that for certain people they can be harmful. The safest path is to listen to your body, track symptoms, and work with clinicians to make informed choices. If you found this helpful, share this video with someone you care about, and bring these questions to your next medical appointment. Thank you for watching, and take care of yourself. Small changes can make a big difference in how you feel as you age.